Idasanutlin is an oral MDM2 inhibitor that in a small study that we conducted here at Mount Sinai in 12 patients with Polycythemia Vera who've previously failed a prior therapy, we demonstrated activity both in hematologic response, spleen response, symptom response, as well as modulation of the driver mutation burden. This was a therapy that unfortunately was limited in its ability to be administered over multiple cycles due to GI toxicity, but clearly had activity. It was the initial study that endorsed or stimulated the phase 2 global study of Idasanutlin in high-risk PV patients who had failed hydroxyurea. We'll present the data at ASH in this cohort of patients that were seen in multiple centers, again, replicating broadly the fact that this was a drug that had clinical activity, both in achievement of hematologic response, phlebotomy freedom, and symptom and spleen responses in those patients who had spleens, even in patients who had previously seen and failed Ruxolitinib. Unfortunately, again, we saw that the ability to administer this drug in a chronic disease like Polycythemia Vera, cycle after cycle, and it's only for 5 days out of a 28-day cycle, but GI toxicity, typically on days 2 to 6, over time became limiting for many patients. And although it wasn't substantially grade 3, 4, even grade 1, 2 nausea, queasiness, diarrhea can lead to quality of life issues and challenges in keeping patients on and compliance with a therapy for a chronic disease. So although I don't think Idasanutlin itself will move forward in clinical development in Polycythemia Vera, again, capitalizing on this theme of MDM2 inhibition to upregulate P53 pathway, other drugs are moving into that space, including KRT232, and both Incyte and Novartis have MDM2 inhibitors that are now moving into the clinic, and we will need to look at both the activity, but also the tolerability from a GI perspective with these drugs. But it is clear to me, at least, that this class of drugs has activity in wild-type P53 patients with myeloproliferative neoplasms, and a lot of that credit goes to the laboratory work of Min Liu and Ron Hoffman at Mount Sinai that demonstrated that MDM2 is upregulated in hematopoietic stem and progenitor cells of the MPN clone from primary samples of patients with these diseases, and that these drugs, such as Idasanutlin, have activity in upregulating the P53 pathway and inducing death in these cell populations. And interestingly, and maybe importantly for the future development of these drugs, can be used in combination, for example, with interferon alpha or JAK inhibitors or other novel therapies, to have synergy, perhaps reduce the dose or duration of the therapies and try to mitigate the GI toxicity that's seen with this class of agents.